The we're still in the anterior, lower anterior region, and we agreed so far that we might find here nutrient canals and the lingual lip, a mental ridge. However, the appearance or the presence differs from one case to another. As you can see here, it's not always the same, and you might also expect here the presence of radiolucencies, bilateral radiolucencies that are present on either side of the midline, and these are the mental foci or the mental fossa. The mental fossa is located just apical to the mental ridge, and it is a depression on the bone, on the mandible. By the way, fossa, when it comes to radiography, fossa is an area where is diminishing of bone trabecules. Unlike a ridge, the ridge is increase in the number of bone trabecules, so they would appear more radio opaque. A fossa, on the other hand, is an area where is diminishing of the bone trabecules, thus they will appear more radiolucent. Here you will also see the lingual pit, as you can see it over here, the mental fossa, those two depressions. However, the mental ridge is not as clear as we've seen them in the previous radiograph. But here you will see that the lingual pit is surrounded by a radio opacity. Don't mind this. This is a scratch in the plate. But you see those two radio opacities. Those two radio opacities are the genial tubercles, and the mental fossa is also seen in this radiograph. And the lingual foramen, as you can see it here, we call it foramen here because it's more of a proper foramen. And you will see, as I said, the extensions, the genial trabecules. The genial trabecules, interestingly, those are two bony or sometimes four bony projections. They are present on the lingual side of the mandible. They extend posteriorly, in a posterior direction. So when you take the radiograph from here, if this is the lingual foramen, and the projections are this way, okay, and this is the lingual surface over here of the mandible. When you put the film in here, and the lingual projections are within the line of the X-ray, so they would appear as two radio opacities that are present around the lingual foramen or the lingual pit. But in reality, they are extending backwards. If you take an occlusal radiograph and you extend the film from down, then you will find the lingual genial tubercles extending posteriorly. So this is another thing that we should take care of in 2D, is that when the structures fall within the path of the X-ray, you will not see them, you will lose depth. If you want to see it, you have to look from underside, and this is when you change the technique or change the way or the relationship between the film and the structure itself. Now we are in the canine area. In the canine area, there is, you can see central, lateral, and this is canine, premolar, and premolar, first, second premolar. Here there is nothing specific, except sometimes you see, of course this is the pathology that is related to these teeth. This is not something normal, but you might expect to see here you won't see the lingual pit. You might expect to see the mental fossa. You might expect to see the mental ridge present in this area. There is no other radiographic entity that is specific to this area, unlike the images that we have seen in the central incisors. In the premolars, of course, you know the premolars from their shape, from the number of the roots, cusps, and we usually have the images of the premolars. They come also the same with the images of molars, because they, because of the size of the film. And the most important structure that you would expect to see, anatomical landmark I mean, that you would expect to see in this area is the mental foramen. The mental foramen, which is the exit, the end part of the inferior dental canal. Mental foramen is it's a strange actually structure in terms of location and in terms of size and the position. This mental foramen, sometimes you will find it in between the apices of the lower premolars. Sometimes, if these are the premolars, you might find it here. Sometimes you might find it down, again between the premolars. Sometimes you will find it more towards the 5. Sometimes you will find it more towards the 4. Okay? In most of the cases, it is a circular opening. Sometimes it might take an ovoid shape. The position of the mental foramen actually is more or less, plus the anatomical position, it is more or less affected by the direction of the beam. If you come from down, the mental foramen position will shift up. If you come from top, go down. Okay, because the teeth will be elongated. If you increase the angulation, then the image will be compressed, so they will be closer to the apex of the teeth. So the mental foramen, as you can see it in here, which is a bit vague in this radiograph, this is the mental foramen over here. You will see it now. It is located in between the apices of the 5 and the 4. It is more or less rounded in appearance. Another radiograph here where there is extraction of a premolar. See, the socket is still not filled. This is the lamina dura of the socket, and these are the bone trabecules which are present on either side, buccal and lingual. There is no filling yet of the socket, otherwise it will appear completely homogeneous. You don't see this. The socket will be completely closed. Anyways, we're talking about the mental foramen now. The mental foramen is located here more towards the middle third of the root, as you can see it over here, more towards the middle third of the root. In the previous radiograph, it was more or less more towards the first premolar, and the level was even lower. So this is, again, as we said, it is more or less affected by the anatomical variation and the direction of the beam of the X-ray, which again play a role in either elevating or bringing the level up or bringing the level down of the foramen.